Is chronic diarrhea keeping you up at night? It is frustrating for my patients who are constantly having diarrhea. They're worried about, where's the nearest bathroom? Am I going to soil myself? It is debilitating and embarrassing for them. If you tried everything but nothing has worked, I'm here to tell you there may be a secret culprit of why you're having diarrhea. Bile acid malabsorption. In this video today, we'll discuss exactly what is bile acid malabsorption. We'll discuss the trouble with diagnosing this condition for doctors. We'll discuss some of the unseen symptoms with this condition. We'll discuss how I treat this, how I diagnose this as a Mayo Clinic trained GI doctor. And at the very end of the video, I'm gonna give you my recommendations on what I recommend to get this diarrhea taken care of so it's not controlling your life. If you're having chronic diarrhea and no one's figured out what is going on, this video is for you. Guys, let's talk about poop. Howdy, I'm Dr. Islam. I'm a board certified gastroenterologist trained at the Mayo Clinic. Of over 10 years of treating thousands of patients with all sorts of diarrhea issues. If you're having problems with your gut, we would love to be a partner on your journey to helping you out. Visit us, LubbockGastro.com, for more information. So this video was inspired by a patient of mine named Sally. Now, Sally is a 72-year-old female who's been having chronic diarrhea, and she's seen all sorts of doctors for this. She's tried all sorts of medications and over-the-counter supplements, and nothing seemed to work. And she was frustrated because it was affecting her quality of life. She could not go out to her weekly bridge competition because she was so worried about her diarrhea. She was always on the lookout for where the nearest bathroom was. And so when she came to see me, we did a deep dive of understanding what the root cause is, and we figured out she actually had bile acid malabsorption. So what exactly is going on? So bile acids are particular substances secreted in your liver to actually absorb fat. Whenever you ingest food, especially fatty foods, that fat needs to be absorbed to be used in your body. And bile acids is actually one of those substances that can help you to absorb fat. Now, normally, bile is secreted and gets reabsorbed in the small intestine as the job is finished. But in some individuals, the reabsorption process does not occur effectively, or you actually may be producing more bile than what you normally should be. And this is when the trouble begins, because your colon does not like excess bile. In fact, if you have too much bile in the colon, it irritates it to cause a tremendous amount of diarrhea. And these are the individuals that try everything for the diarrhea, and it does not work. So you can't absorb nutrients properly, you feel bloated, obviously you're having diarrhea, and it feels like a ticking time bomb for you. Now here's the hard part. Your body doesn't just scream, hey, I have too much bile, stop. And the reason is because there's not a good way for your body to really let you know, is the bile the issue, or is it another condition like IBS? In fact, a lot of my patients get diagnosed with IBS and they get treatment with IBS medications and they don't feel better. But the root cause is actually too much bile salts in your colon. This is why it's going on. So you may have been diagnosed with IBS or a sensitive stomach, when in reality, it is literally the bile that's irritating your colon. And because of this, the treatments are directed towards that as opposed to the treatments that are directed to actually minimizing the amount of bile in your colon. So how do we diagnose this? So the first thing I do is I look at the particular symptoms that my patients complain about. So one of them is having diarrhea right after you eat, especially if it's meals that are high in fat. If my patients complain to me, hey, Dr. Islam, as soon as I eat, boom, I gotta use the restroom, that's my first clue they actually may have bile acid malabsorption or diarrhea. And it's not just about the diarrhea, it's the urgency. It's how unpredictable it is and how it can affect my patients' day-to-day lives. So if I hear these terms like urgency, I gotta go as soon as I eat, I gotta find out where the bathroom is, this gives me a first clinical clue that it may be bile acid diarrhea. Number two, I look at their history. Have they had a history of getting their gallbladder removed? If that's the case, that clinches the diagnosis for me. So as a reminder, your gallbladder is an organ to store bile. It just is a tank that holds bile, and that's what it does. When you lose that tank, guess what happens? All that bile has nowhere to go, and it just gets secreted from the liver into your small intestine, into your colon. It's like the faucet is on, and things keep on rushing through and through and through. Or if you have a history of a small bowel resection, especially in what's called the terminal ileum or the cecum. If you've had part of your colon removed or your small intestine, especially the end part, that's also a clinical clue that you may have bile acid malabsorption. Your terminal ileum and your cecum, which is the connection between the small intestine and the colon, act as a brake to hold on to the bile acids that are trying to go into your colon. Normally, our body, if we have not had surgery, can use this anatomical location to prevent bile from going into your colon. But if you've had surgery in that area, you lose that brake, and so all this bile goes into your colon to cause irritation. And then lastly, you may have all your body parts, but you still may have too much bile. 20% of all IBS patients have bile acid diarrhea, even though they've had no types of surgery. What's going on? Now, we do have specific tests for this. We have the CCAT test or the bile acid breath tests. I don't use these because number one, they're very expensive. And number two, if I just listen to my patients, that's all I need. So if I suspect somebody has bile acid diarrhea, here's what I do. And here's what I did with my patient. I gave them a trial of a bile acid binder. Now, there are two main ones that we have in the medical field: cholestyramine or Welchol or Cosavelum. These actually bind up the bile to reabsorb it and to make sure it does not go into your colon. And it's very effective to help out when it comes to bile acid diarrhea. Sometimes we use other supplements like ox bile or certain food eliminations, which I have a video on, to help out with when it comes to bile issues. But this is a very effective option, and I cannot tell you the number of patients that tell me they feel so much better whenever we try these options. Now for my patient, this is exactly what we did. I put her on a bile acid binder, and lo and behold, she felt so much better. She can go to her weekly bridge games. She was not controlled by her diarrhea, and we got her taken care of. So if this sounds familiar to you, come visit us at LubbockGastro.com. We can find out exactly what's going on and get you feeling better. Let me know in the comments down below if you've tried these options to help out. What has been your response? How's it work for you? I cannot tell you the number of patients in which we diagnosed them with bile acid diarrhea. After years of being unclear what they had from other people, they felt better, we got them on the road to recovery, and they were able to get their lives back. All right, guys, thank you for watching. If you haven't already, don't forget to smash that like button, like, share, and subscribe. Visit us at LubbockGastro.com for more information and to make an appointment so you can see us today so we get down to the root cause of why you're having your issues. Look forward to seeing you guys on future videos.